Hello, and welcome to Joint Replacement Education class. I'm Dr. Robert Burnett, and I'll be walking you through what to expect during your upcoming surgery and how you can best prepare. Let's get you ready for a successful surgery. This course will go over a lot of the same things in your pre-surgical packet, so please refer to that for additional information. If you have any questions that come up during this class or leading up to surgery, please reach out to my office at the number provided below and at the end of this presentation. Thank you. Here's what we'll be going over today. We're going to talk about why and how surgery is performed. We're going to talk about things we can do to prepare before surgery. We're going to talk about the typical hospital course and what to expect. We'll touch on pain management and medications that you'll be receiving after surgery. We'll talk about a typical recovery course and when you'll be following up with my office. We're going to talk about possible complications and how we can modify those through proper preparation and communication with our team. Knee and hip replacements are performed when the cartilage or shock absorbers have degenerated to the point that there is bone rubbing against bone, and non-operative interventions such as ibuprofen Aleve, PT, and cortisone injections are no longer providing relief. For knee replacement, surgery is performed through an incision over the front of the knee and is typically 8 to 10 inches in length, but may vary based on size of the bone, as the incision must be large enough to fit the implants in. I perform most of my hip replacements through an anterior approach. The anterior approach allows for a faster recovery and more stable hip joint after surgery. There are several important things you can do before surgery to decrease your risk of an infection or complication after surgery. We recommend you apply mupirocin ointment to your nostril every day for 5 days prior to surgery. This helps to eliminate MRSA and other bacteria that may increase your risk of an infection after surgery. Apply a raindrop size amount of ointment inside each nostril at the tip of the nose. You can press on the sides of your nose after application of the ointment to rub the ointment in. This medication is also included as a prescription in your surgical medications, which can be picked up 1 week prior to surgery. We also recommend you wash the surgical area with Hibiclin's antiseptic soap every day for the 3 days prior to surgery. Instructions for application are included in your preoperative packet. The Hibiclin's wash is included as a prescription in your surgical medications and can be picked up 1 week prior to surgery. The wash is also available over the counter at local drugstores like CVS and Walgreens. This medicine is also called chlorhexidine gluconate solution if you're going to buy this over the counter. Remember, do not use Hibiclins on your surgical incision after surgery. This may be a change from some of your friends or family who have had a joint replacement surgery recently. We used to tell patients not to drink anything starting at midnight the night prior to surgery. However, we now understand that being well hydrated during surgery helps with recovery. Thus, we want you to drink a Gatorade 5 hours prior to surgery. So if your surgery is listed for 8 a.m. start, try to wake up between 2 to 3 a.m. and drink the Gatorade. If your surgery is listed at 2 p.m., then have your Gatorade at 9 a.m. This should be the last thing you drink before surgery, and you should not eat anything after midnight the night prior to surgery. Avoid red-colored Gatorade, as this can make it harder for anesthesia to assess your oral airway. If you have diabetes, please drink a glass of water or sugar-free Gatorade. This is not mandatory and your surgery will not be canceled, but this can aid in your success. To be safer from a cardiopulmonary perspective, the anesthesiologist will give you sedative medication so that you're not awake during surgery and you will not remember anything from surgery. There may be certain situations in which spinal anesthesia is not possible, in which case the anesthesiologist will perform general anesthesia. In general anesthesia, there is a tube placed down the throat, and the anesthesiologist is providing you with medications to keep you breathing during surgery. You will meet your anesthesia team prior to surgery. Let's review how the day of surgery will go. The day prior, you will receive a call from one of the preoperative nurses who will give you the surgical time, when to arrive, and when to stop eating and drinking before surgery. On the day of surgery, you will present to the hospital that you are having surgery at the indicated time. You will spend an hour and a half to 2 hours in the preoperative holding area before surgery, and there you will meet the anesthesia team. Surgery typically lasts between 1.5 and 2 hours, and there are additional times for positioning as well as reversing anesthesia. You'll be in the recovery room for 1 to 2 hours prior to moving to the orthopedic floor, where you'll be working with physical therapy. If you're going to be discharged on the day of surgery, the physical therapist will see you in the recovery area following surgery and make sure that you're adequate for discharge. There are several things that our team in the hospital will look for before sending you home. We want you to be confident in your ability to get around your house safely. Therapists will work with you to make sure you're using a walker or crutches appropriately. We'll make sure your vital signs are appropriate, and if you're spending the night in the hospital, we'll check labs in the morning to ensure that your electrolyte count and blood count is okay. Lastly, we want to make sure your pain is well controlled on the medications that you're going to be going home with. Let's discuss how we're going to control pain after surgery. Midwest Orthopedics offers a variety of options for ice therapy, which can be an extremely valuable method for controlling pain after surgery. The Cryo Knee Kit is an ice bucket and knee brace that circulates cold water around the knee after surgery while providing additional compression to the knee. The package is covered by insurance, however, there is a $49 cost to the patient. This is much cheaper than the other ice therapy machines on the market. If you purchase the pack, we will apply it in the OR and provide the bucket for you to have hooked up after surgery. Ice packs can be very effective as well, and these can be purchased at Midwest DME stores or over the counter. Someone from Midwest DME team will reach out to you before surgery to set you up with the Cryo Knee Kit if you are interested. Elevating the leg is another very important thing to remember for pain control after surgery. The key thing to keep in mind are making sure your knee and foot are above the level of your heart. So you want to lean your head back and raise your leg up. In addition to ice therapy, medicines to manage pain after surgery are very important. So I will spend a few minutes talking about these medications and a few other meds that we want you to take after surgery for blood clot prevention and stomach ulcer prevention. Meloxicam is one of my favorite medications for pain control after hip or knee surgery. This is a non-narcotic, so is non-addictive. It's a strong anti-inflammatory agent. This should be taken once per day in the morning with food and continued for at least 60 days after surgery. Tylenol is another anti-inflammatory medication. This should be taken 4 times per day. Oxycodone will be very helpful for the first few days after surgery. This is a narcotic medication, so we will want you to decrease this after 3 to 4 days at home when you start to know where your pain levels are. Tramadol is similar to oxycodone in that it is a narcotic, but it is weaker. It can be helpful early on to stagger your oxycodone and tramadol tablets so that you are not getting behind the pain wave. However, you'll also want to decrease this medication as your pain becomes better controlled. I recommend getting off of the oxycodone first and using the tramadol to help, and then decreasing the tramadol. Most of my patients won't require any narcotic medications 1 week after surgery. The other medications on this list are not pain medications, but they are important. Aspirin will be taken twice per day for the first month after surgery to decrease risk of blood clots. Senna is a stool softener to help with constipation, which is common after anesthesia and when taking narcotic medications. Protonix or pantoprazole helps protect the stomach lining when you are taking meloxicam. Zofran helps with nausea, and this medication can be taken as needed. This is a sample medication schedule for the 3 to 4 days following surgery. This same chart appears in your pre-surgical booklet. These times can be altered based on whatever time you get home from the hospital or start your first dose, but I recommend taking oxycodone, acetaminophen or Tylenol, meloxicam, pantoprazole, ondansetron, and aspirin at the same time to start your day, whether that is at 6 a.m. or 8 a.m. Then 2 hours later, you can take tramadol as a way to stagger the pain medications that you're receiving. You're then taking oxycodone and acetaminophen on every 6 hour cycle with tramadol staggered in between that for the first few days. As your pain control improves, start to decrease the oxycodone. Senna should be taken every 12 hours for constipation while you are still taking oxycodone or tramadol, as these narcotics will cause constipation. Ultimately, this is just a guide to help you understand how you can schedule your medications after surgery. This does not need to be adhered to strictly in the sense if your pain is well controlled, you do not need to take oxycodone around the clock. Start to decrease the oxycodone first and then work on decreasing the tramadol. Acetaminophen and meloxicam should be continued for several weeks if these are tolerated because they are so effective with controlling inflammation after surgery. This table is also in your pre-surgical packet, and this is intended to be used as a guide for taking your medications after 1 week to about 3 months after surgery. I want you to continue to take Tylenol and meloxicam. You'll take aspirin for the first month. Continue to take the Senna doxycycline while you are taking tramadol for constipation. Continue taking the pantoprazole while you are taking meloxicam to protect your stomach lining. Please call our office if you have any questions. You will have a silk mesh dressing placed over skin after closure. This is then covered with a Mepilex waterproof dressing to be on the skin for 2 weeks. You may shower with this dressing starting 24 hours after surgery. There is no need to wrap with additional plastic wrap when showering. You should not be submerging in pools, hot tubs, or baths until cleared by me. After 2 weeks, we'll remove the bandage and dispose of it. This will expose the silk dressing underneath, which can remain for 1 week longer. This is occlusive and waterproof as well, so you can continue to shower. This may fall off on its own, in which case you can just remove it as it falls off. I like to tell patients that they can trim the edges as it starts to lose adherence to the skin. You should not be applying topicals, lotions, salves, or ointments until cleared by me. This video shows what removal of the silk dressing at approximately 3 weeks after surgery will look like. It's important to apply pressure to the skin as you pull the dressing off of the incision, revealing the underlying incision. If there are any concerns with the appearance of the wound, such as drainage or redness around the borders of the wound, don't hesitate to call our office. Therapy is an important part of recovery after hip and knee replacements. I have a team of therapists that will visit you in the home a week after surgery if you live in a region that has this service. If you are in a region that does not have this service, then I want you to start physical therapy on your 3rd week after surgery, after I've had a chance to look at the wound in clinic. If you are in a region that offers the outpatient in the home therapy, you can expect a call from the service a few days prior to surgery to coordinate the visit for after surgery. You'll follow up with me 2 weeks after surgery. At that time, we will take a look at the wound and remove the dressing. If you have nylon sutures, which are non-absorbable sutures, we'll remove these at this time. I will then have you follow up again 6 weeks after surgery, at which time we will get an x-ray and perform a repeat inspection of the skin and the wound. If everything appears good at that visit, then we will have you follow up with us at 1 year post-operatively. As far as returning to activities after surgery, there are several things to keep in mind. We recommend that you return to work if it's a light duty or desk job at 2 to 4 weeks post-operatively when you're off narcotic medications and can perform the tasks at hand. If you're returning to a heavy duty or labor-intensive employment, then 6 to 8 weeks may be necessary for full recovery. In regards to driving, research shows that at 2 weeks, your brake reflex is back. However, you should be aware that if you're having surgery on the right lower extremity, this may take longer to return to driving. As far as flying goes, we are okay with you flying after you've had your wound check appointment with me at 2 weeks. We do not provide implant cards anymore, and you can let TSA know that you'd like to go through the scanner. We prefer waiting 6 weeks between staged surgeries for the other side. As far as returning to exercises, by about 6 weeks, you should be 75% recovered and able to return to most activities, but it takes 6 months to a full year to get back to 100% of your preoperative abilities and full recovery. There are several risks and complications to be aware of prior to surgery. All of these risks are low, however, they are worth mentioning and can be serious. There are problems associated with anesthesia, including heart attack, heartbeat irregularities, and stroke. In very rare situations, a person may die from complications related to surgery. There is a risk of blood clots, pulmonary embolism, infection, instability, and joint stiffness. There's a risk of differences in leg length following surgery, angulation, or rotation of the leg. There is a risk of fracturing of the bone, potentially requiring future or repeat surgery. There's a risk of hematoma, which is blood accumulation within the knee. There is a risk of nerve injury or blood vessel injury, which can lead to numbness or tingling in the foot, as well as difficulty moving the foot or ankle. Blood loss can occur during or after surgery, which may require transfusions. There's also a risk of insomnia following surgery or difficulty sleeping. And findings after surgery include swelling or bruising throughout the leg, warmth around the incision or leg, incisional redness, and a low-grade temperature of less than 101.5 degrees. You're more than welcome to call if you have any concerns and discuss this with our team further. If you notice any of the following, then we certainly want you to call. This includes calf pain, swelling or redness within the calf and leg, fevers greater than 101.5 degrees, significant drainage from the incision, pain uncontrolled with medications, or spreading redness around the incision. I would like you to sign up to receive texts from me around surgery with important updates and check-ins on how you should be doing after surgery, as well as things you can do to improve pain control and be compliant with the medication schedule that we have provided. The instructions for signing up are shown on this slide. This is directed by the rush internist or your primary care provider that you saw prior to surgery. Prepare your living arrangements as necessary so that you have ease with getting around your house. Designate a team member or somebody that can be available to you the first few days after surgery, and we'll check in on you. Sign up for the Stream MD texts, which I outlined in the slide prior. Wash your surgical area with Hibiclin soap as instructed in the pre-surgical packet. Apply the mupirocin ointment to your nostrils 5 days prior to surgery. Stay well hydrated and eat nutritious meals. And finally, relax and know that you are in good hands. Thank you for watching this video and being an active participant in preparing for your upcoming surgery. It will surely help you achieve a great outcome. My team and I are always available should you have any questions along the way. Don't hesitate to contact us at the numbers provided here. Thanks.